Another Day, Another Attack on Reproductive Healthcare. This collection of articles was released last week by the Heritage Foundation, which if you don't know of them, they are the ones who released Project 2025, and it's entitled Treating Infertility, the New Frontier of Reproductive Medicine. I just wanted to take some time to dive through some quotes from this article or collection of articles that is written by a whole bunch of people, none of which are reproductive endocrinology and infertility specialists or people who practice medicine in the reproductive healthcare field. Let's start with this banger of a first line. Infertility is not a disease or condition. Beg to differ. One big theme throughout these articles is a focus on traditional families. So they say here, for a married couple, talking about ART procedures that are used for non-traditional family procreation, talking about how some of these techniques would deny children the right to have a genetic mother and father and impacting the culture's notions of motherhood and fatherhood. They also go about this in a little bit of a more subtle way by attacking the use of donor eggs, donor sperm, gestational carriers, which are often used by people who don't have either sperm or egg or uterus in their relationship.
This is their way of saying exactly who they think deserves to have a family. There is also personhood language scattered throughout this document, and we know how dangerous personhood language and defining life at fertilization can be to reproductive health care and options that are available currently to provide a high level of success for fertility treatments.
They also spend a lot of time attacking conventional medicine, claiming that we're too busy to take care of our patients and we are just slapping band-aids or pushing them towards more aggressive treatment options because it benefits us. This is no mistake. Discrediting and smearing physicians who've trained for years in this specific field of medicine is going to make people look elsewhere, and wouldn't you know, they have some solutions for you.
This alternative restorative reproductive medicine, wouldn't you know, it addresses all of the main issues that come with conventional medicine. They claim that they examine the whole body and use fertility awareness-based methods, hormone balancing, nutritional adjustments, don't sell quick fixes, and do the necessary difficult work of treating the underlying diseases. These are all things that good reproductive health care providers are doing. But the authors of these articles know the buzzwords, and they sound a whole heck of a lot like wellness influencers who are trying to scam people. And where would they be without an attack on birth control, saying that women need their cycles and that birth control is just masking symptoms of all of these diseases? Things like PCOS and endometriosis, which admittedly, many people have been failed by the healthcare system when talking about these disorders. Although a lot of that comes from lack of research and funding in the women's healthcare sphere, which leads to limitations in treatment options. And there are some emotional patient testimonials that really hammer in the point. And if all else fails, they attack the science, talking about eugenics, talking about making babies from 4 different people, having an inexhaustible supply of eggs and embryo farming, and stealing Brad Pitt's DNA to make your own children. As a reproductive endocrinology and infertility specialist who takes care of people every single day who are trying to build their families, this document is very scary to me. It sets up conventional medicine as the bad guy and sets up an alternative that will not help the majority of people who need reproductive health care to build their families. It's a not so thinly veiled political move to try to limit your options.